BBC Coventry and Warwickshire at 2:10 Monday afternoon. This is Darren Spence in for Brodie Swain. And sometimes in life you just get introduced to somebody who you just go, wow, you're going through all that and yet you can still do this. Ladies and gentlemen, let me introduce you to Stacey Woollerton. Good afternoon, Stacey.
Good afternoon.
Stacey is currently putting aside her own struggles to help other people. Stacey from Warwick was told that her cancer was treatable but not curable. She's decided to use her own experiences of chemotherapy to create a lovely thing. Care packages for other people who are going through the same thing. This is a lovely, lovely idea. You brought one of them in.
Yeah.
First of all, let me ask you how you came to the idea of bringing out these care packages, because obviously that's what we're talking about today.
Yeah, I mean, chemotherapy is a really daunting thing to go through. You get explained, what you're going to expect, but until you're actually sat there in that chair, having that needle that's stuck in you, and then the drugs going in you, and then dealing with the aftermath of it, sickness, the fatigue, constant injections for a week, you can't really prep yourself for it. So having done it myself and sitting it, I'm actually doing it. I've got a treatment again on Friday this week.
Yep.
I just wanted to do something nice for people for their first ever treatment. So I came up with this idea only last Saturday, actually, 19th of October, to do these little care packages, which have got all sorts of little things in to help you on your first day, like a pack of tissues, some nice shower gel for when you get home, a nice little bag to carry them in, some sweets, a book, crisps, just little pick-me-up things while you're sat there, going for your first one, something nice to open. The
example that you brought in, I see Paul O'Grady's book in there.
Yeah.
That'll be a good read.
Exactly, a bit of a giggle.
Good. A lovely distraction.
Yes.
Of course, this is part of it, isn't it? Because
it is.
You need things to distract you from the actual treatment while it's ongoing.
Yeah.
And then I'm guessing you also want things that are going to just take you to other places in your mind. You don't want to be thinking about it.
No.
For anyone who hasn't been through it, just take us through a little bit about what happened with you up to your diagnosis and then what you have to now go through. So you found out in 2017?
I found a lump in my breast in 2017. Went to my doctors and was told I had estrogen receptive breast cancer. I've then had to go through 7 operations in the past 2 years.
Wow.
I had a lumpectomy, cavity shave, opted for a double mastectomy. Had reconstruction and stuff like that. My last surgery was in January of this year, where they took fat from my stomach and used it to even the implants out.
Right.
So I look a bit more symmetrical. And then, so I dealt with all that. So January came this year. I thought, great, I can get my life back on track. I've got my 6-year-old son. I can start to put that past 2 years of hell behind me and move on. And then in May this year, while I was at work, I noticed my stomach felt a little bit odd on one side. And my boss said to me, get to the doctors now, because I know you'll be panicking, quite rightly so. I did. I got sent for an ultrasound. And in August this year, I got told I have secondary breast cancer, which has spread to my liver. And they can treat it, but they can't cure it. So I will be a cancer patient for the rest of my life.
Okay, so you're going through treatment how regularly at the moment?
So I'm having 6 sessions of chemotherapy first. I'm just about to sit number 4 on Friday, and I have that every 3 weeks.
Right.
And then they're hoping to put me on some sort of medication to keep it balanced.
Yep.
But every 3 months for the rest of my life, I'll be scanned. If the tumours start to grow again, I will then have to have another form of chemotherapy. So basically, my life is now chemotherapy, medication, scans, and so on and so forth. It's just so they can keep me here as long as possible, spend as much time as with my little fellow as I can. So
absolutely. What was his name?
Keegan.
Keegan. Lovely name as well.
Yeah.
So we're in a situation where obviously you're going through the treatment, you're going through the drugs, and not everybody will be exactly the same, obviously, with the way that their body responds.
Yeah.
Have you noticed common threads with other people that you've spoken to with regard to these care packages and other cancer patients? Have you noticed there are certain things you've all got in common?
Yeah, I mean, I've spoken to, obviously when you get in this circumstance, you can't really talk to people that haven't gone through cancer or aren't going through cancer. So there's quite a lot of really good groups out there, and I've touched base with a lot of them. I've made some, it sounds showy, but I've made some really nice new friends. You know, one of my best friends, Kathy, I met through both going through the same situation. So they've been really helpful, because I've sort of said, you know, is there anything that you've had in your care pack, you know, that you've put together yourself that you've took with you, you know, and one said, oh, well, I like my puzzle books.
Yes.
You know, and my other friend sort of said, oh, yeah, you got to have a bag of crisps, you know, and so it's been nice, because other people have said, well, yeah, well, I always take this with me, so that would be nice to put in. So, and that's how we've come up with how it came up with this.
It's a nice idea, because obviously, you know, there are things like, I don't know, maybe you get a bit of energy and a bit of salt maybe from the crisps. Maybe do they taste different when, for example, if you're going through the treatment, things like that, because there's all these details that people, somebody like myself who's not been through it doesn't have a clue about.
You don't have any sort of symptoms on the day. So on the day, I do what's called the cold cap as well, which is why I've not lost my hair. And it's this cap thing that goes on your head that freezes your head to -10 degrees.
Right.
For about 4 hours to 5 hours. And it's to save the follicles in your hair. Yeah, it hurts. You get ice in your hair.
Yeah.
It's really bad. But I find eating something in that first 10 minutes stops me from thinking about the pain that I'm going through. So that's why I always take sweets and stuff with me.
Yeah.
But other friends have said they do it, they take it. But on the day, you don't really have any sort of symptoms. It's the next couple of days when all you can really taste is metal. Nothing really tastes nice. So you kind of go for the foods with a bit of kick. So yeah,
spicy foods.
Yeah, a bit of Indian takeaway, a bit of curry, you know, things like that. You got to have a bit of kick. So yeah, so I mean, having things like the crisps and stuff, it does give you that salty, you know, the saltiness and stuff, which is good because it helps build your salts up in your body and stuff as well.
So you said you had this idea for the care packages last Saturday, just gone.
Yeah.
And you were sat there and you thought, well, hang on a minute, I can pull all these ideas together, which is a lovely thing to do. But you've gone a bit above and beyond that. You've not just put this out as an idea, as a suggestion to people and said, hey, guys, if you know somebody who's going through chemo or whatever, this is a good idea to do. You've actually gone and physically brought the ideas together in one package. So, as you've said, we've got the crisps, we've got the tissues, we've got the book and stuff like that. Not any one care package, though, will be the same, will it? Because it's people donating things and you're bringing various elements together.
Yeah, so basically I came up with the idea. I thought, do you know what? I would have really liked it if on my first day somebody had handed me a box and said, I know what you're going through. Here's a little something from me to you to make today, your first chemo session, a little bit easier. And I thought, right, so again, talking to my friends, and we were all sort of like, they said, oh, you know, yeah, put something like this in, something like that. So, I mean, the one I've bought in to show you now, we've got a little bag. We've got some blusher, so because you know we still like to look nice even when we've had treatment.
Absolutely,
you know,
absolutely. Some
shower gel, nice book, nice scarf. You know, if they lose their hair, they can put it around their head. If not, they can just wear it. Bag of crisps, some sweets, and some tissues in this one. You know, so.
But of course, the lovely thing about it is it's not just what's in it; it's just the fact that somebody's thought to do it.
Yeah.
It's the fact that somebody's put this together and people have donated the various items that are in there. So you've done how many so far? You've distributed how many in the week and a half since you came up with the idea?
I know, it's crazy. I've had 4 go out.
Yep.
Which people have touched base with me and said, you know, could I potentially have one? I've got a friend or an auntie. It's about to start chemotherapy. We've got 25 made now in my living room. And so I'm seeing Warwick Hospital on Wednesday, and I'm hoping to distribute my first lot around the Aylesford unit on Friday when I go in for my treatment.
Oh, fantastic. So you're going to be there and actually dishing these out while you're going through it yourself?
While I go through it myself.
You're remarkable.
Oh, thank
honestly.
you.
It's such a simple idea. I'm amazed it's not been done before. I mean, certainly not in this form where you've put the nice bow and the cellophane wrap around it as well. It is lovely, and it does look like somebody's basically getting a birthday gift.
Yeah.
It will make their day.
Yeah, I mean, this is what I wanted to do. I didn't want it to just be like, here's a bag full of stuff, good luck.
Yeah, carrier bag.
Yeah, here's a carrier bag full of stuff, you know, or like, look, I wanted something that had a bit of impact and that made them feel special on what can potentially be one of the worst days of your life, you know. Because if they were anything like me, the night before I had my first treatment, I just curled up on my kitchen floor and sobbed my heart out because I just did not know what to expect.
Well,
I was so scared.
I mean, the fact that somebody has thought about people that are going through chemo is one thing, but the fact that someone going through chemo has thought about this and is pushing the idea out there is wonderful. Of course, the packages are free because it's donations.
It is.
And the place to go to is Stacey's Chemo Care Packages on Facebook.
It is.
A couple of hundred likes already, I notice.
Yes.
Could do with a lot more. A few more zeros on the end of there, please.
Lot more, yeah, a lot more. And we have got like designated drop-off centres, which is listed on the Facebook page.
Brilliant.
There's about 20 different drop-off centres all around Warwickshire. And there is also a little list of the sort of ideas that are ideal for donations on there as well.
Great. So help for people that are checking it out for the first time.
Yeah.
Okay, so that is Stacey's Chemo Care Packages. Look it up on Facebook. Stacey Woollerton, an absolute pleasure to meet you. Thank you so much for coming into BBC Coventry and Warwickshire this afternoon.
Thank you for having me.
Lovely lady, Stacey, that just came in. Do check out Stacey's Chemo Care Packages. It's Stacey with an E. And it's just a phenomenal idea. Stacey Woollerton herself going through chemotherapy just thought, I know, how can we make this a better experience, a more painless experience for other people going through the same thing, and creating a care package is just to make people realise that they are thought of and they've got something to support them if they're going through that at the moment. Absolutely brilliant. Do check it out on Facebook.